Let's have spirited discussion, but I really enjoyed the discussion that we had, and we threw out a lot. I mean, we need probably like 5-6 hours more, but we did a lot in the time allotted to us. So what we did, we started out, and I want Lori to jump in here a lot. But we started out with what is wrong with the healthcare system and what is needed, and then trying to come up with maybe not solutions or policy ideas to address the problems that we identified. So, we said, make more, healthcare needs to be more accessible. And one way to get at that, one deterrent for people accessing good quality healthcare and getting regular checkups is a lack of insurance. And we know there are 47 million Americans who still don't have insurance, 9 million of whom are children. So our first point is to enact a publicly financed national health care system. And we actually had a lot of discussion about how we should actually write this. We had universal health care, we had single payer, and in the end we came up with publicly financed. Do you want to talk about how we arrived at this?
Sure. I think probably many of us in this room feel that the word universal has been co-opted, even just in the last year and a half, 2 years. It has been taken by politicians now to mean a lot of people, but it's not universal. And some of us are proponents of single payer, some of us not. But single payer is in my view, truly universal. But at any rate, so different individuals in the group, we talked about what is a term that is both politically, potentially viable, and still has the spirit of actually covering everybody. Since the term universal, the group felt it no longer carries that weight because it's been misused. So that's how we came up with publicly financed, which of course that's the government paying for it, and that is national.
And these would be some of the components of a publicly financed system. The current publicly subsidized programs we have, while they've done their job to a certain extent, they're replete with problems, and we thought that we would take this opportunity to reform the system to address problems that are currently pervasive in like Medicaid and state child health insurance program and Medicare. So one problem with Medicaid is that the reimbursement rates to providers are not equitable. So when we ask for this to be instituted, we want to make sure that reimbursement to providers is equitable. That you're not getting paid, I mean, it's definitely going to be based on, the state cost of living, but, we have in our state, the reimbursement for, a procedure in one part of the state is different in another part, or different for children. So we want to address that. Taxpayer finance system, maybe, government share and a taxpayer share, and of course this is all up for discussion. And then worked into this as well, improving access to pharmaceuticals, maybe more generics available. We know that not everyone can tolerate generics, but we should have it more available if they're cheaper. And then finally, more money for research. Research is on the decline, especially for pediatric-based research. So maybe, that would be incorporated in reforming the publicly financed system. So moving on, do you want to?
Sure. So incentives to providers, a category of policy that would give incentives to providers to provide higher quality care. So clearly, the cost of education is going out of control. So we're talking about loan forgiveness and scholarships to practitioners to practice in underserved areas. And also we wanted to really highlight the shortage of nurses in this country. 20,000 people in this country die a year because they check into hospitals with overworked nurses. So we don't have enough nurses. It's not enough to just increase their salaries. We actually need more nursing schools and more innovative incentives, more innovative ways to actually educate and retain nurses.